Well, for couples deciding to have a kid, a child in their life, it can be so exciting. Stressful, some might say as well, especially if it's not happening as fast as they think it's going to happen. And for a lot of couples, I bet you that's the case. That was the case for me and my husband. We're like, why is this not happening right away? We've got Dr. Myron Bethel, OBGYN here at Renown. For anybody who's trying to have a baby, is there a timeline? Is there like, you should be having a child by this, after this many times, etc.?
I don't really think there's a timeline. First of all, I think that people don't realize that pregnancy is the exception. It's not the rule. So basically, for any fertile cycle that you have about a 25 to 30% chance of conceiving. That's assuming that you don't have any subtle things wrong, such as ovulatory dysfunction, such as excessive weight, or in the instance of a couple, the husband having a low sperm count. Those sort of things have to be considered in the formula. And if there are things wrong, it could be much lower than 30% per cycle.
So how does a couple prepare and make sure that they are healthy enough?
Well, I think that they should prepare by trying to make themselves as healthy as possible. That means good exercise, good sleeping habits, good nutritional habits, get their weight down as low as possible. And then they need to do critical assessment as to what their health is like. Do they have underlying medical problems? If they do have underlying medical problems, then they would benefit from actually seeing a physician before they even attempt to get pregnant.
So maybe that's the appointment that you need to start with first and foremost if you're thinking this is the right path for you and your partner.
I think so. Ovulatory dysfunction is a big thing, but 40% of infertility is due to the male, not the female.
Hear that, ladies?
So things such as low sperm count, and as the male becomes older, there's things that can go wrong with the scrotum, like a varicocele. There's a reason embryologically why the scrotum is on the outside of the body, because it's very temperature sensitive. And if the temperature is too high, like it's someone who uses hot tubs a lot, or exercises, or uses those very fancy Lycra gym shorts, they may have difficulty conceiving because their sperm count may be low.
A lot of questions, and if you've got more questions, of course, you can always find them at bestmedicinenews.org. And good luck for all those couples out there who are trying to conceive. Dr. Bethel, thank you so much for being with us.
My pleasure.